Hi, Dr. Liu here. Just wanted to walk you through what to do to change your knee replacement dressing. A knee replacement dressing, you'll see that you have that white strip, which is just an indicator strip. You've got the plastic one around that. At our dressing change, I'm going to talk you through what we do with our nurse Mel at the time of a dressing change. It's quite straightforward. We remove the dressing and replace it with a hyperfix dressing. And if you are a regional patient, I would have already given you this option, and you can change the dressing yourself. Please request a dressing pack from us, which I'll give to you when you're in hospital at the time of your post-operative care. Otherwise, we may well give you one before the surgery as well. If you don't have access to that, sometimes calling in to see your doctor or your general practitioner may be more safe and more beneficial. As always, any questions or concerns, send me a picture or send me a text message at any time. Hope this helps. I look forward to seeing you or speaking to you soon. Thank you. All right, so we have our dressing here and we've got Mel, who is our nurse, helping us today. Before we start, Mel will wash her hands. So make sure that you're cleaning your hands before touching the dressing. From there, you can see that the dressing's all intact and it's looking very good. We will remove the dressing in one go. There's no need to be too gentle here. The wound should have actually healed reasonably well. You'll notice the purple coloration on the dressing, which is the antibacterial glue. And this is what the wound looks like at the 2-week mark. And that looks absolutely fantastic. There's wrinkles on the skin, which is suggestive of a reduction in swelling, which is exactly what we want to see. Now, we do have a betadine or alcohol, depending on what you have, swab, and we'll provide that for you. And we'll just use that to wipe over the wound once. So starting either at the top or the bottom and swiping along the wound once, that will just remove any sort of chances of any bacteria that might be on the surface or coming into the surface from touching the wound. We allow that to dry and then place our hyperfix dressings over the top. Now, the hyperfix dressing is a non-waterproof dressing. It's designed to remain on until it falls off. That could be days to a week or two, so you can leave it on and have a normal shower. Because the wound for the knee is curved, you will have to curve this dressing. The alternative to that is to cut it in half and to put 2 strips on if you're more confident with that. And as you can see here, it's much easier to place the dressing on when the knee is bent so that it does not pull off when you start to bend the knee. So please feel free to get this dressing wet in the shower. Just pat it dry, don't rub it dry, otherwise it will catch the edge and fall off prematurely. That's all there is to the dressings. Any issues, please let me know.